in the world of epilepsy, pediatric or adult, anywhere in the world, the incidence of seizure control on medication is about 60 to 65%. That means 30 to 35% of people do not get seizure control on anti-epileptic medications. And the International League Against Epilepsy actually recommended, initially in 2010, and then with new recommendations that came out last year, that after a patient has failed two appropriately administered epilepsy medications, they should be referred for a surgical consultation. And I just want to make it clear that talking to a neurosurgeon and getting a pre-surgical workup is not having surgery. There's evidence that just going through that workup increases your quality of life outcomes by 30% because that pre-surgical testing is involved and they might be uncovering other aspects of your epilepsy that they didn't know about before, or an underlying condition, or other treatment options that aren't even surgical, right? So that's really important to remember. The referral to surgery is just to have that conversation, have all your tools in the toolbox. So I would say every drug-resistant patient is a candidate for epilepsy surgery. I don't think we would have said this 2 or 3 years ago, but with these new advances in neuromodulation, laser ablation, endoscopic procedures where they don't have to take the skull out to do a lobectomy, a lesionectomy, or even a hemispherectomy. Some are being done endoscopically. Every person is a candidate for surgery if they have failed two appropriately administered and tolerated medications, and that includes ketogenic diet, CBD, and the over-the-counter pharma, right? So if your child has failed a frontline anti-epileptic and the ketogenic diet and CBD, they have technically failed two medical treatments, and they should at least be referred to the neurosurgeon to have that conversation.